Hi friends, welcome back to my channel. My name is Ina and I am oncology pharmacist. After the last video I did explaining Ironmouse immunodeficiency condition, I received so much support from people that care about her and even from Mouse herself.
A pharmacist made a video about me? Oh, I see it. He reacts to you talking about your condition, helped us better understand what you're going. That is so nice. Well, thank you, pharmacist.
But this just made me want to know more about how she got sick in the first place and what her future is going to look like. To do that, we need to learn about her past. So today, I watched the hour-long interview that Ironmouse did with the Immunodeficiency Foundation, or IDF, to talk about her entire journey. And I want to help answer the biggest question that's in all of our minds. Even though her health is improving and she just became the #1 most subscribed person on Twitch of all time, is she ever able to meet the friends she made along the way? Is there ever a chance for her to be cured? And the answers might surprise you.
I wasn't diagnosed till much later, but I've always been. I like to explain it like I'm an extrovert who was forced to live an introverted lifestyle because I was always a very curious child and I was adventurous, but out of all my siblings, I came out pretty sick and I was always sick and my parents were very, very, very protective of me. They were afraid any little step I take, I would get ill. And so I was very sheltered growing up.
So we have baby Mouse here. In the last video I made about Ironmouse, I explained that she has a diagnosis of CVID, common variable immunodeficiency. To explain it simply, people with CVID cannot make their own antibodies, so they cannot fight any infections. If you want to learn more about how Ironmouse deals with her CVID while being a streamer, you can check out that video. I'll put the link down below. So she probably got a lot of lung, sinus, ear, or eye infections because those are very common in kids with CVID. These sound like pretty typical infections that all kids would get, right? But those with CVID will get them again and again, and they will be really severe and they cause more longer lasting damage to the body. But that's exactly why it's so hard to diagnose CVID in a kid. Children's immune system are not very strong yet. A strong immune system means having a strong memory. When a bacteria presents itself to our body, we develop antibodies to fight it. But at the same time, we take a picture of it and we memorize it forever. Kind of like Light Yagami in Death Note, where he has a photographic memory and he can remember all the names and faces and he writes them down in his Death Note. But because kids have an immature immune system to begin with, it's very common for them to get sick all the time. So it's difficult for doctors to make that leap and think to test a kid for CVID. The first time someone did make that leap and found the first case of immunodeficiency was not even that long ago actually. It was only in 1952 where a young boy was getting sick repeatedly and nobody could understand why. So finally, his doctors decided to test for his antibodies levels, thinking that they're gonna be sky high because in healthy people, if you get the same infections again and again, you're gonna have a whole army of antibodies ready to fight infections, right? But what they found was the exact opposite. This kid basically has no antibodies at all.
I've been seeing a lot of doctors since I was very young. It always just seemed like something was wrong with me. They kind of like thought that it was just like asthma and allergies with like something else, but they didn't know what the something else was. It's just, oh, well, maybe if we try this, she'll get better. Or maybe if we try that, she'll get better. And nothing ever seemed to work. I had like really bad food allergies growing up, really bad allergies to everything was like allergies because I was always sick and I always had respiratory infections and I always had sinus infections and I would get constant ear infections. And it got to a point where I started missing so much school, where I was always in danger of getting kicked out of school, getting in trouble. And I always had to work extra hard to get good grades because I missed so much school.
Statistics say about 1 in 3 people have allergies. I personally think it's probably even more because a lot of people might not have a proper diagnosis. But only 1 in 25,000 people have CVID. So the chance of having allergies is like 8,000 times more than the chance of having CVID. It's probably really obvious to us now because we know Mouse has an immunodeficiency, but naturally the doctors suspected allergies first. Also, it takes a lot to get a diagnosis of CVID. First, you need confirmed low levels of IgG in your body, which is the main type of antibodies. Second, you need confirmed low levels of either IgM or IgA. The third is really crazy. You need to exclude all other immunodeficiency conditions, and this is what we call a diagnosis of exclusion. What that means is basically like playing 20 questions. So, are you a celebrity? No. Are you a TikToker? No. Are you a streamer? Yes, but that's not all. There's one last item needed for a diagnosis of CVID, and we're gonna talk about that in a little bit because Ironmouse actually mentions it herself. If Mouse was able to get a diagnosis earlier, her life would probably look quite different. She could get on medications earlier, she wouldn't go through so many horrible infections, which left permanent scars in her body.
As I grew up, I was really sick as a kid, and then when I got a little older, like I hit like puberty, things got better a little bit. Puberty kind of like helped me out a bit, and I started not getting as sick as much. And my doctors were like, "Oh, well, she's getting better. She's improving. That's great." So I was fine for like my first teenage years, and then all of a sudden I hit 18, and my body was just like, "Nope, that's it." Everything started going haywire again, and it was worse than when I was a child, and it was very overwhelming for me because I'm here trying to make it through school, and I had to drop out of school because I just couldn't. Oh God.
Oh, no.
I'm getting a little emotional thinking about it.
All right, now we have teenage Mouse, and it sounds like these are her good years. Why do people get better during puberty? We don't really know the answer, but during puberty, our bodies go through a lot of changes. We get changes in levels of sex hormone, growth hormone, and these changes can affect all of the systems in our body, including the immune system. And in Ironmouse's case, it sounds like her body has finally given her a small break from all the infections she was having in her childhood until she hit 18.
And they were like, "Wow, you're all grown up now, but you're back here." And I was like, I explained to them everything that happened, and I said, I improved and stuff, but I turned 18 and everything just went to hell again. So I don't really know what to do anymore. And they looked over my history and they said, these are a lot of infections back to back, and these are a lot of hospitalizations. And they were like, "I think I want to get you tested to see if maybe you have a primary immune deficiency disease." Because at first they thought, so the first thing I got tested for was cystic fibrosis, which came back negative.
Cystic fibrosis is another rare genetic disease. It's when a certain protein in your body doesn't work properly, and it makes all your organs really thick and sticky. So in the lungs, this stickiness actually traps a lot of bacteria, causing repeated infections. So it is a respectable suspicion from the doctors.
Everybody thought that that's what I had because the respiratory infections I kept having was just insane. It was just like really bad. And they're like, "We're gonna test for primary immune deficiency disease," and I got the pneumovax vaccine, and well,
and you had no response. Okay.
So this is university student Mouse finally putting together the last pieces of the puzzle. Remember when I said to diagnose CVID, you need to check off all these boxes, and having no response to a vaccine is the final box to check off. So Mouse said she got a vaccine called Pneumovax. It is a vaccine to prevent pneumonia, and I've personally given it to many patients. It's highly recommended for those over the age of 65, but also recommended for people with chronic diseases. It's called Pneumovax 23 because it actually covers 23 different types of bacteria. It's basically presenting our body with a dead version of this bacteria. So in healthy people, how should our bodies respond to this? We'll memorize what they look like and produce a lot of antibodies, right? So how do you think Mouse's body responded? That's right, nothing, no response. So now we finally see the full picture and we understand what that something else all those doctors are struggling to find is missing. A functional immune system able to produce antibodies.
And I remember I got a call from my doctor, and my doctor was like, "Well, we really need you to come in." And I'm like,
that's so nerve-wracking.
Okay. So I went in and they were like, "I know what's wrong with you." And I'm like, I felt relief, but I also felt fear at the same time because I'm like, holy oh, I'm so sorry. I didn't mean to curse. I'm so sorry. This is the moment that I've been waiting for. I finally have an answer as to all these years as to why they were like, "We know what's wrong with you. you have CVID. And I'm like, what is that? And I remember my mom was crying because the first thing she asked is like, is she gonna die? And the doctor's like, well, if she takes care of herself, she'll be fine. And I was just like, okay, but that's when all these questions started appearing. And I'm like, what is this? I've never heard of this before in my life. And the doctor sat down with me and explained to me everything. And I felt like I didn't listen to a word because I heard common variable immune deficiency disease. It was like all of a sudden my brain, like what my soul went somewhere else.
By the way, that's a totally normal response.
Do you understand that you have to go on treatment? And I'm like, yeah, okay.
Finally getting a diagnosis does provide a lot of relief, but at the same time, it's probably one of the most stressful points in the whole process. Mouse described it so accurately as well, and it's so interesting to me personally to hear it from a patient's perspective. She says that her brain kind of just goes blank, and it's hard for her to absorb all that information we try to dump onto patients within that 30-minute appointment. So that's totally fair and understandable. I'm not a doctor, so I'm never the person giving out the diagnosis, but I've done so many new drug teachings to patients who just got their diagnosis. And I can tell you, I'm there going on and on about how this drug works, what are the side effects, what to watch out for, when to call us for anything bad. And the patient kind of just sits there and nods along and trying their best to comprehend what I'm saying. And at the end, I'm like, so did you understand all of that? Is everything clear? And they just go, well, that was a lot of information to process. I can't think of any questions right now, but I'm sure they will come up when I go home.
Mouse's immunoglobulin levels were so low that her doctor insisted she start IVIG treatment the next day. Her first infusion was disastrous. The facility that cared for her wasn't necessarily equipped or fully trained on the administration of IG replacement. She didn't receive pre-meds, and the medication was applied far too fast, causing an extreme reaction. Eventually, as her body became accustomed to the infusions, she experienced both improvements and setbacks.
I've explained what IVIG is in my last Ironmouse video, but to explain it again very simply, it's the drug that has the antibodies extracted from all the plasma from thousands and thousands of donors. That's why she's always encouraging people to donate plasma so people like her can get their treatment. So what does it mean to get an infusion reaction? The name doesn't sound that scary, right? But it could actually be a life-threatening reaction. We've all heard anaphylactic reaction. It's a life-threatening allergic reaction when the antibodies in our body start to freak out and go crazy. But Mouse doesn't have any antibodies, and that's why she's getting the IVIG. So how is she still getting a reaction? Well, it turns out there can be other non-antibody related reactions to IVIGs. The body might develop a rash and blister. You might have really fast heart rate, which we call tachycardia, really low blood pressure, which we call hypotension, fever or shakiness, which we call rigor, and basically go into this very, very scary reaction. I'm not sure exactly what was Ironmouse's experience, but we always take these reactions really, really seriously. To prevent this, there are a few things we can do. First is to give patients pre-medications or pre-meds. For IVIG specifically, we can give Tylenol, which is acetaminophen, some kind of NSAIDs, which are anti-inflammatories, antihistamines, and sometimes even steroids. We should also be really careful with the rate of infusion. If you infuse these drugs too fast into the body, you're giving the person a higher chance to react. Also, patients should be well hydrated before getting their IVIG. They can either drink lots of fluid before they come, or sometimes we even give IV hydration to people before their IVIG. I work in a cancer hospital, so we give a lot of blood products or biologics to patients, and for every single drug, there is such a strict protocol of what pre-meds, what the infusion rate is, and how much hydration to give for each of these drugs. So getting an infusion at a not well-equipped or well-trained infusion center is kind of scary. But probably because how fast she needed to get this done and due to the cost, she might not have any other choice.
We had a lot of financial issues at home. And it was pretty scary for a minute because I had to miss a lot of treatments. That was another issue that I had. I missed a lot of treatments because, simply we couldn't afford it. We were having issues with insurance. Also, the fact of my age, I was so young. And the insurance companies was like, well, she's so young and we don't think she needs this. This is very strange and this is very expensive. And I had to jump through so many hoops to try to get things to happen. And sometimes it just didn't work out. So there was moments where I just
Oh,
couldn't
wow.
get my IVIG and I would get worse. So I think that the fact that I couldn't get adequate
That's
medical
horrible.
care and adequate medical resources to me because of financial issues, I feel like that played a lot in my severity.
That's so upsetting to hear that insurance company wouldn't cover IVIG because IVIG is what we call the cornerstone of CVID treatment. Like, this is it. It's currently the only option to treat this condition. What does it mean when someone misses treatment? Well, we heard it from Mouse herself. She definitely got more severe because of these missed treatments.
My health declined in such a way where it's like I was so severe. I became so severe I couldn't be around people.
Definitely.
Any type of contact with like my family or with friends, or I would get sick like so quickly. Like it got to the point where I couldn't leave my house. I was always on medicine. I was always on IV antibiotics to the point because I couldn't take oral anymore because orals just did nothing to me.
And the more antibiotics we use on a person, the higher the chance the antibiotics stop working to kill the bacteria. And this is what we call antibiotic resistance. I see this happen sometimes in our really sick cancer patients because the chemotherapy they were on killed all of their white blood cells, and now they have a really bad infection and they have to be put on IV antibiotics. If that IV antibiotic didn't work, we give them something stronger. And if that doesn't work, we move on to the next. And it can take weeks to months to get rid of an infection in someone with no immune system, and they have to stay hospitalized for a really long time.
That I would never even dream of having. I caught shingles. I had shingles, and it's like, at my age, shingles?
Shingles is also really scary. It's caused by a virus called herpes zoster. Sometimes it's so bad, it can actually develop in someone's eye and cause blindness in people. It can also leave people with lifelong nerve damage or nerve pain, so it's definitely not something you want to get.
So many strange things happened back to back where it's like, I just ended up having to get so isolated. I was put on
Wow.
oxygen. I had to get, percussive therapy for my chest, and I had a nurse coming over all the time. I had to be on IV antibiotics and antivirals and all this stuff, and not to mention all the stomach issues that you get and having my gut torn to shreds. It's a lot.
In the last Ironmouse video, we talked about her experience with oxygen and her antibiotics use, so I'm really thankful that she shared why she was put on those treatment in the first place.
I remember the day that I came home from my diagnosis, I just started Googling like crazy. I was Googling everywhere. I was frantically Googling, and I couldn't find anything. And I'm like, Jesus, I don't even know how to look. Like, I just found like the most vague stuff, and I found the IDF, and I was able to get in touch with people. And I remember I was so terrified. I was so scared, but it was a bittersweet relief to me because I found people that were like me, and I found people that understood what I was going through. But it made me sad because it's like the fact that other people are going through this too just tears me apart.
I'm so glad Ironmouse was able to find support and a sense of community through the IDF. I find that online, chronic diseases, especially rare ones, are not talked about as much as I would like to see. For example, cancer is still such a mysterious and sometimes taboo subject. But as a patient, I think it's so helpful to find a community where you can talk about these kind of things very freely and safely. So I'm super supportive of that, and I'm sure that's one of the biggest reasons why Ironmouse keeps giving back to the IDF, because she's found so much help and support through them.
And one day he told me, he was like, man, it would be really cool if you could like meet up with me in Japan. Like, you would love Japan. And then I told him everything. And I've never done that before. I just straight up told him. I was honest from the beginning. And I was like, I have CVID, and I explained to him all this stuff. He's like, I have never heard about this before. And he cried. He cried for me. I remember the first cyclothon, we were talking, and he was telling me he wanted to do a cyclothon, and I was like, oh my God, why? And he's like, because I want to raise money for charity. And I'm like, well, how long are you gonna do it for? And he told me, oh, a few days and whatever. And I didn't want to like ask him because I figured it was some cause there or whatever. And I was like, okay, so what what charity are you gonna do it for? He goes, oh, I'm doing it for the IDF. I'm like, what? I'm like, why? And he's like, what do you mean, why? Are you not happy? And I'm like, I am happy, but I just want to know what brought this on. And I just want to have a beer with you one day.
So I think we all want the biggest question answered. What does the future look like for Mouse? This is current Mouse. She's getting her meds regularly, she can go on her treadmill, and she can do even a month-long subathon. It sounds like she's doing so well, right? But can she ever meet her friends in real life? Like Connor, who lives all the way in Japan. And the short answer is possibly. Let's imagine two different scenarios. Connor or other friends coming to visit Ironmouse in her home, or Ironmouse traveling to see her friends. So before we even consider these possibilities, what needs to happen is anyone she gets in contact with need to get their full vaccinations. And I'm not just talking about the COVID and flu vaccines, they need to get updated on all of their vaccines. Something really cool is that the IVIG she's getting is from donated plasma from thousands and thousands of people, right? So there is already a certain level of flu antibodies in the IVIG she's getting. Also, obviously, those people who come to visit her should not have any active infections, so anything like a fever, cough, vomiting, or diarrhea. If she ever wants to travel, again, it might be a possibility, but it all depends on how she's doing with her treatment. We definitely wouldn't recommend traveling to remote areas for people who have CVID because they wouldn't be able to access good healthcare. We also recommend patients bring their home medications, including any antibiotics that they might need, and eat and drink from clean sources. So if that day ever comes, I'm sure all of her fans will be so overjoyed because not only does it mean Ironmouse is gonna have so much fun, it also means her health is doing better. And naturally, the next big question we want to ask is there ever a cure? Now, we're getting into the realm of possible future treatments, and there's not a lot of science to back this up, and a lot of it is my personal opinion. I'm not an immunologist, and I'm not a research scientist, so please don't take everything I say here super seriously. But for my last video, I've got so many interesting comments and suggestions from you guys on how to cure Ironmouse condition, so I thought it would be fun to talk about some of them together. A lot of you guys have asked if it's possible for Ironmouse to get a transplant. That's a very logical train of thought. Since antibodies are produced by white blood cells are produced from our bone marrows. If we give someone a bone marrow transplant, wouldn't that fix it? And that is in fact possible. We can actually transfer stem cells from one person to another so they're able to produce good white blood cells. But stem cell transplant comes with a lot of risk and complications as well. Someone else suggested a fecal transplant. What is that, you ask? Well, it is exactly what it sounds like. You take the poop from a donor and you place it inside the receiver's intestine. So right now it's only FDA approved for a certain gut-related infection called C. diff, and I don't see it being potentially used for treatment of CVID, so this won't be a good cure for Mouse. And finally, a lot of you suggested gene therapy. And I see where you're coming from because CVID is basically caused by some problem with the person's DNA. So maybe fixing the DNA can fix the disease. And you'd be right actually. Gene therapy for CVID right now is under clinical trials. And maybe one day it can become a treatment option. To be able to modify a gene on a person's DNA, a technique called a virus vector has to be used. And I made a reaction video of using gene therapy to treat lactose intolerance. If you're interested, I'll leave that link down below. I'm so happy I watched the interview Ironmouse did. She gave me a lot of good insight into the patient's experience with chronic conditions, and I'm really thankful that she's doing whatever she can to spread awareness and create safe spaces on the internet for people to be able to talk about their conditions. If you enjoyed this video, please don't forget to give it a thumbs up and subscribe for more contents like this. And I'll see you in the next one. Bye!